Hello, everyone. Thank you for joining us for today's webinar entitled Alternative Payment Models, Affirmant Health Partners. Prior to beginning today's presentation, I have a disclaimer to share with you. By participating in this Alterum Institute webinar, you automatically agree to authorize recording and audio and visual content presented during this event and consent to subsequent use of the recording in the public domain by Alterum Institute. This recording may include questions and responses provided by you during the live event. This recording will be made available after the conclusion of this event as part of the Alterum Institute webinar archives and will remain available indefinitely. If you do not wish to consent to the recording, please do not attend this event. And if there are any questions, please contact Sylvia Romer at sylvia.romer@alterum.org. Alterum Institute webinars are intended solely to provide information to the public. The views and opinions expressed as part of these webinars do not necessarily state or reflect those of Alterum Institute. It is not intended, nor can it be relied upon, to create any rights enforceable by any party in litigation or to endorse any other organization or service. With respect to these webinars, neither Alterum Institute nor any of their employees makes any warranty, express or implied, including the warranties of merchantability and fitness for a particular purpose, or assumes any legal liability or responsibility for the accuracy, completeness, or usefulness of any information, services, products, or process disclosed or represents that its use would not infringe privately owned rights. My name is Dee Daly and I am today's moderator. During today's presentation, all participants' lines will be muted. If you have a question, please type it in the questions box in your GoToWebinar interface and we will address your questions during the Q&A session. Due to the large number of attendees for today's webinar, we may not have time to answer all of your questions. If we do not address your question during today's broadcast, you will receive an answer through email. Following today's presentation, a link to the recording and additional reference documents for Affirmant Health Partners and the Federation ACO will be provided to you via email. Today's presenters include Drs. Ronald Gonzalez and Bill Mayer. Dr. Gonzalez is a private practice family medicine physician. He is the Assistant Medical Director for Covenant Healthcare Partners PHO and Chairperson for Affirmant's Federation ACO. Dr. Mayer is a preventive medicine physician and epidemiologist. He is the President and CEO for Affirmant Health Partners and the Federation ACO. Drs. Gonzalez and Mayer will provide an overview of their organization to include their APM structure and performance record for quality and cost savings. They will also review their time commitments, workload, support, and financial incentives, which accompany a partnership with Affirmant Health Partners and the Federation ACO. Information provided will help you determine if you benefit from further discussions with Affirmant Health Partners. Please note the information you will hear in this broadcast is current as of today and is only intended to be a general summary. I am happy to introduce Dr. Mayer, who will begin today's presentation.
Thank you, Dee, and good afternoon, everyone. Again, my name is Bill Mayer, and it's a pleasure to be with you this afternoon. I want to thank you for the opportunity to present to you about Affirmant Health Partners and the Federation ACO. Let me begin by saying that we view this as essentially an introduction to what Affirmant is about. And we hope that after you hear what we're about, that you'll have an interest in learning more. And we will welcome that opportunity and look forward to speaking with you about your specific needs and interests. And we'll give you some contact information, both at the end of the presentation and in follow-up materials. I'd like to begin with the next slide, please. In introducing our leadership team here at Affirmant, we're very fortunate to have a highly experienced and accomplished team that can bring assets and their many talents to help you in being successful in your work. You heard a little bit about me, so I won't go into much more detail about that, except to say that my background includes having served as a Senior Vice President in Quality, Community Health, and Managed Care at Bronson, and also as Corporate Medical Director and Executive Vice President at Kellogg Company, among other background. And then I'd like to introduce our Director of Clinical Transformation, Karen Pross, and she is a PharmD with experience over a number of years at Spectrum Health, also with Michigan Medical PC, which is a large physician-owned multi-specialty group. Larry Green, who is our Director of Payer Strategy and also ACO Operations, and he brings to us experience as Vice President for Operations at Presence Health Partners and Vice President Managed Care for Ascension Health, and led managed care contracting for a number of years at Advocate Physician Partners. Katie Velton is our communications leader and has a Director of Communications, and she has years of experience as communication leader at Stryker Corporation, serves on the board of the Michigan Society for Healthcare Planning and Marketing. Paul Peabody is our information technology and business intelligence executive, and he has over 30 years experience as a chief information officer at Beaumont Health and Bronson Healthcare, and was instrumental in Epic's successful launch of Community Connect. Finally, I want to introduce you also to our newest leader, Becky Trella, who is an RN and master's prepared in terms of Master's of Science in Nursing. She has joined us just this week as our clinical operations executive and comes with a background as Vice President for Post-Acute Care and Care Management at Bronson, and also over 30 years as a leader at Advocate Physician Partners, which is, you may know, is one of the largest and most successful ACOs in the country. So that's our leadership team. I also would like to, if you go to the next slide, introduce you to Dr. Gonzalez. You heard a little bit about Ron from D, and the fact that he serves as chairperson of the Federation ACO Board of Managers. And I'd like to turn the floor over to you, Ron, to share some of your thoughts about participating in Affirmant and serving as the leader of our Federation ACO.
Okay, well, thank you, Dr. Mayer, and thank you, Dee, who's covered some of what I do, but just a little bit more insight on me. I'm an independent family medicine physician. I practice in a little town called St. Charles, which is St. Charles, Michigan, which is close to Saginaw. I've practiced there for 20 years. I've lived there for 30 years, and have raised 6 children with my wife there. I'm also a member of Covenant's Physician Health Organization, the PHO. I also serve as Assistant Medical Director, as was stated. I also serve on their Board of Directors for the PHO. I was hired primarily to develop, implement, and oversee a physician mentoring program at the PHO that helps us to address the different metrics, cost of care, and gaps in care issues that we deal with. I'm also the chairperson of a network development committee at our local clinical integrated network at Covenant, in charge of trying to engage specialists and get the primary care physicians and specialists to work together. As Bill has said, I also serve as chair of the Federation ACO Board of Managers. So that's a little bit more about me, and thank you, Bill.
All right, well, thank you, Ron. If you go to the next slide, what we'd like to cover in our presentation today, and then we look forward to having questions from you at the end of the presentation, is first just a little bit about how we perceive the current landscape in healthcare, a little bit more about Affirmant, our strategy and how we're organized and how we operate, some of what we see as the key challenges and opportunities that we have before us. And then I'm going to turn it back to Dr. Gonzalez to talk about benefits to participation in Affirmant and the Federation ACO from a physician perspective, and then we'll be turning it over to you for any questions you may have. So if you go to the next slide, just briefly, we thought it would be helpful to share with you some of our views about the current landscape, first in Medicare and then in the commercial arena. And as I think you all are well aware, the aging of America is driving substantial growth in Medicare. And you can see that between 2015 and 2030, we're looking at dramatic increases in the number of Medicare beneficiaries in Michigan and across the country. And of those Medicare beneficiaries, more recently, we've been seeing substantial growth in Medicare Advantage plans. Now in Michigan, we are at 42% of all Medicare beneficiaries participating in Medicare Advantage plans, which is both a challenge and an opportunity for us. Also, you are, I'm sure, familiar with all the changes that came with MACRA and MIPS, and the fact that CMS is making it very costly for physicians to stay in fee-for-service Medicare. Sometimes we refer to it as guaranteed downside to distinguish it from downside risk. So that certainly has been a dramatic change. And CMS is continuing to drive providers to assume both upside and downside risk through some of their newer programs, Pathways to Success, direct contracting, and primary care first being three of the more recent additions to their programs. If you go to the next slide, in the commercial arena, we're starting to see changes that are promising to bring big challenges and opportunities for us as well. Blue Cross and Blue Shield has announced their Blueprint program with a very Medicare-like or Pathways-like features to it, with up and downside risk over the next few years. You've, I'm sure, heard a lot about the Aetna and CVS merger, and certainly Aetna has a lengthy experience in working with clinically integrated networks across the country, and CVS offers minute clinics, which run the potential of interrupting and interfering with our relationships with patients in managing total cost and quality of care. Haven is the venture with Amazon, JP Morgan Chase, and Berkshire Hathaway, which is looking to transform healthcare, and news reports have indicated that their strategy will include working with clinically integrated networks across the country. And then, of course, United Healthcare is now the largest employer of physicians in the country. So dramatic changes happening in the commercial landscape as well. But as challenging as these changes are, the landscape is even more challenging for our patients. And if you'll go to the next slide, recent data from the Gallup organization indicates 1 in 4 patients are skipping medical treatment due to cost. 45% are concerned that one major health event could lead to them having a bankruptcy or having to declare bankruptcy. $88 billion was borrowed by consumers last year to cover their health care costs, and 15 million Americans forgo medicine for serious health conditions due to cost. So I'm sure many of you have seen this in your own practices when patients tell you they just can't afford the care that we're offering, or worse, don't tell us about it and then end up foregoing care without our even being aware of it. So the landscape is such that we recognize that we have both challenges and opportunities, and that's what Affirmant is about, is helping our participating physicians to navigate successfully through these changes. And as you think about the decision that you have to make, if you'll go to the next slide, Katie, you have a decision to make about how to deal with these changes. Do you sit on the sidelines and hope for a better day? And obviously that includes some potential cost of inaction. Or do you pursue a do-it-yourself approach? Do you work with vendors that are out now engaging physicians and wanting to work with physicians to meet these challenges? Do you work with other CINs, other clinically integrated networks, or do you consider Affirmant? And we would like to suggest that there are some criteria that you might want to think about as you make these decisions. And we would suggest that you consider things like, what is the role of physicians in governance? What is the opportunity for you to play a part in the governance and in leading the work of the Clinically Integrated Network, or ACO. What is the opportunity for you to get large numbers of patients that would make it more reasonable for you to manage the risk financially of taking downside risk? If there's small numbers of patients, then you're going to be much more at the at risk for things like catastrophic patient experience and the noise and random variation that comes with small numbers. Is there a captive insurance company that might allow you to take advantage of the private market for reinsurance, which is something that could be very helpful and help with reducing costs? Is there a single technology platform that can be used to allow you to have access to data at the point of care as close to real time as possible and as actionable as possible? What are the opportunities for you to learn from best practices and to share your best practices? And what is the track record for success? And as we go through our presentation today, we'll be touching on each of these themes, so you'll have a sense of what Affirmant has to offer, and perhaps that will be helpful to you as you think about your alternatives. So if you go to the next slide, just want to briefly talk a little bit about Affirmant. We were formed about 3.5 years ago. We have over 5,000 participating physicians, 6 sponsoring health systems that have sponsored local clinically integrated networks, which are joined together in clinical integration between those local networks at the Affirmant level. We cover 75% of counties in the Lower Peninsula, and offer the opportunity of the scale of a large number of patients and opportunities to tap into best practices with your colleagues across the state. If you go to the next slide. I think we may have missed one. Can you go back one slide? There we go. Thank you. Our strategy is to create a healthy Michigan at an affordable cost, and we intend to accomplish this through collaboration with patients, with colleagues, and with community partners to drive better health, affordable cost, more covered lives, and shared rewards. If you'll go to the next slide. This is a little bit about our governance and our organization structure. We are physician-led and professionally managed and collaborative in our work. We have a committee structure that has over 217 committee members from across the state, including a large number of physicians that are involved in our committee structure and in our board and boards to direct our efforts. The board is required to be at least 50% physicians, and at least one of our chair or vice chair has to be a physician. We operate by majority rule, except for limited supermajority requirements for things like new chapters or deleting chapters and capital calls, for example, of our sponsoring systems. We have committees that we use for operational guidance and for making recommendations to the board, and I won't go through all those committees except to say that they span the gamut from IT and business intelligence to finance and contracting, and very importantly, clinical transformation. So if you go to the next slide. This is an overview of our history as an organization. As I mentioned, we were formed in 2015. We just hit some of the highlights here. We approved our strategy as an organization in July of 2016, and in January of 2017, we began our participation in the Medicare Shared Savings Program as the Federation ACO, and also began participation of over 300 of our physicians in the Comprehensive Primary Care Plus program. We launched our post-acute care strategic focus in 2017 as well. And by 2018, we were able to save Medicare $16 million in shared savings in our first year of operation as an ACO, which is, as you may know, highly unusual. And we were able to distribute $7.7 million of those earned shared savings to our chapters for distribution to our providers. We also have launched our Best Practice Learning Collaborative for care management in 2018 and signed our first Medicare Advantage contract with Priority Health in late 2018. So that's just a few of the highlights of our history as an organization. If you'll go to the next slide, please. So with all of that said from our strategy, the question is, how do we create value at Affirmant? How do we create value for our members? How do we create value for payers? How do we create value for our participating providers? And we think about creating value using the analogy of the fire triangle. And as some of you who may have a camping background or as I did a Boy Scout or a Girl Scout background, you probably learned about the fire triangle and the fact that in order to light and sustain a fire, you need to have three elements present simultaneously: oxygen, heat, and fuel. And without any of those elements, you cannot ignite or sustain a fire. So in our case, we believe that we have analogous elements that need to be present for our success. And those are data analytics, clinical transformation, and health plan partnerships. And just to spend a moment on this, if we do not have data analytics, then we really don't know where to focus and we don't know how we're performing. So we need to have data analytics to allow us to be able to focus our efforts and direct those efforts and know that our efforts are being successful. But even if we have that data analytics, if we don't have the ability to improve our performance on cost and quality, then it's not much good to us. We have to be able to actually use the data to clinically transform and to do so in a way that improves both cost and quality. And even if we can accomplish those two things, if we can't capture some of the value that we create through health plan partnerships, then we won't have a sustainable enterprise. So this is what we view as the value add for Affirmant. This is how we bring value to our participating physicians and to our members and to our payer partners. So now I'd like to spend a little time talking in greater detail about each of the sides of this fire triangle. And let's go, if you will, to the next slide and talk about data analytics. So we are very fortunate at Affirmant in that all of our participating health centers, or health systems rather, are on the Epic electronic health record. And we at Affirmant have contracted together to implement Epic's new population health registry and tool called Constellation. And we're the first super clinically integrated network in the United States to launch Constellation. We have over 750,000 primary care attributed patients in the system with both claims and clinical data integrated in a single instance. We have data that is available to us at the Affirmant level, at our chapter level, at the level of our physician practices, as well as at the patient level. And we have valid and reliable standard measures of quality, utilization, and cost, including risk scores and gaps in care at the patient level. And we have a collaboration with other brand name organizations, if you will, throughout the country, such as Johns Hopkins Healthcare, who are also working with Constellation and with whom we're able to share our best practices. If you'll go to the next slide, please. Turning to clinical transformation, our approach has been to identify and to rapidly spread best practices on those aspects of clinical care, both quality and cost, where we can have the biggest impact. And one of the first areas we focused on was reducing skilled nursing facility days per thousand. And that was something we identified based on our looking across the country at what made for successful ACO performance. And that was our first initiative. And over the 2 years, the first 2 years that we focused on that initiative, we were able to reduce SNF days per thousand by 27%. Another area that we focused on had to do with CPC Plus, as I mentioned, and we helped our primary care physicians to apply for that and to succeed in being accepted for that program. And our participation rate is about 2.7 times the statewide primary care physician participation rate. And we've seen and focused on improving chronic disease care management, and again, identifying and implementing best practices related to care management. We've seen already some reduction in inpatient days per 1,000 as a result. We have a clinical transformation system that we use to move through this process of clinical transformation that begins with identifying and developing a best practice, executing that best practice and providing tools and supports for that, and then ultimately rewarding for improved performance in the key measures of success for the best practice. So that's our approach to clinical transformation. If you'll turn to the next slide, when it comes to health plan partnerships, we have currently 3 major areas that we have focused on. The first being Medicare Shared Savings Program for traditional Medicare, and as I mentioned, we've already achieved earned shared savings in that program, and based upon data that we have recently received from an outside third party, it looks as though we're positioned again for success based on our 2018 performance. We've seen incremental significant revenue to our physicians as a result of our higher participation in CPC Plus, and we're also working with our employee health plans of our health systems and with our Medicare Advantage contracted partner Priority Health to also align incentives and to assure that through partnering with our health plan partnership, our health plan partners, that we can gather and share in the rewards of the value that we create. So that's our approach to health plan partnerships. In addition, I thought it would be helpful if you go to the next slide to talk about how we collaborate. We have a number of methods by which we collaborate as an organization, and we enable that collaboration through Affirmant. We have an annual leadership retreat, and we bring together over 200 of our leaders from across the state, many of our physicians and others, to that annual gathering, and we bring in both national speakers and also share best practices amongst ourselves. We have a best practice learning collaborative approach, which follows the Toyota Production System A3 or 9-box process for performance improvement, and we work with our chapters to help to implement that. We have a tool for physician training, which offers physicians free continuing medical education through an online system that was developed as a best practice at Spectrum Health Lakeland. We have monthly evidence-based guides, if you will, for physician behavior change, a guide that was developed by Katie Velton based upon her research at Western Michigan University, our Director of Communications, as part of her master's program. And we make that available through our chapters as well to help to enhance their communication and enabling of performance improvement at the chapter level. If you go to the next slide, we have many vehicles for communicating with our chapters and with our participating physicians. We have an annual value report, and we'll be sharing that with you in follow-up to today's presentation, as well as the slides from the presentation. We have a monthly newsletter that we put out electronically. We have periodic video blogs that we use to make special announcements and highlight certain developments and issues that we may need to communicate about. We also have a website which is designed to meet the needs of both our participating physicians and the general public and our potential partners. And then we have webinars and other events that we put on periodically, both live and virtually, to help inform our participating physicians. If you'll go to the next slide, please. So when we think about what is it that differentiates Affirmant, And the four key elements of our value proposition, they are represented here on this slide. The sharing of reliable, valid, and actionable data, sharing of best practices, jointly contracting to enable us to manage risk and improve payer terms and align incentives, and ultimately to enable us to give control back to physicians and patients in healthcare. That said, if you go to the next slide, we have challenges and opportunities still before us. If you'll go to the next slide, please. And among the challenges, we have disappearing fee-for-service margins, and now if you think about the non-Blue Cross Blue Shield commercial market in Michigan, it's now at 15% of patients in Michigan, which is really is a very small percent of patients to be trying to continue to have a sustainable practice. We're on this forced march to risk, driven by CMS and Blue Cross Blue Shield, among others. And we have continuing loss of autonomy of physicians and patients, with decisions being made more and more about medical necessity and payment by insurance companies. We have opportunities. We can keep care within a network of folks that we collaborate with to be able to better manage the cost and quality of care for our patients. We have high-value clinical transformation programs and the ability to reduce random variation and help ensure our success with taking financial risk for the cost of care. We have the ability to grow our preferred partnerships with health plans and to be rewarded for reducing unnecessary care. And finally, we have the ability to take control over our destiny. And in the current environment, that is a really important opportunity that we see in coming together. So with that overview, I'd like to turn it back to Dr. Gonzalez to offer his thoughts on the physician benefits of participating with Affirmant.
Okay, thank you, Dr. Mayer. Well, listening to you reminds me of all the things a few years ago when you initially came to Saginaw to present Affirmant to Covenant, about the things that got us excited about belonging to Affirmant and going forward with the collaboration with all of our other healthcare partners that are involved. But anyways, I'm asked to speak to the benefits of for the physicians, and as you can see on the slide, there's bulleted points of all the benefits, and I'll let you read that. But I'd like to speak more to, from a physician perspective, what my views are of the benefits of the Federation ACO. So before Affirmant came along, our PHO, a group of us at the PHO, like to think of ourselves as prospective thinkers, understood that the integrated network model was a vehicle for the future, as we saw the changing landscape of how we were being reimbursed, less fee for service and more fee for value, as been outlined. But it was a struggle to try to bring together, how do we do this as a small group in a local community hospital. And then along came Affirmant. The struggle in part had to do with how a group of us small doctors got the hospital to buy into forming an ACO at our local level. And there was some hesitancy on the hospital's part. Well, the hospital finally became to understand the value of the ACO model and brought Affirmant to town to speak to us. And we realized that joining hands with some of the healthcare partners in Affirmant allowed us the kind of scale that we needed and the infrastructure support that we needed in order to pull this off in our local community. And Affirmant and the Federation ACO provided that. And these were things that we couldn't do on our own at a local level. We liked the fact that it was physician-led. This rang in the ears of our local physicians. And so many times that the mantra you hear at physician-led, it's being allowed to sit at the table at various hospital meetings and hospital organizations and committees. But at Affirmant, there was the guarantee almost of that we would have a voice at that table. And as Dr. Mayer has pointed out, it's required that we sit on the boards. It's required that we have a voice and participate in the governance and some of the formulation of the different programs that are available at Affirmant. And that was something that was really appreciated at our local level. I'd also like to point out that through the work through the ACO, the first year ACOs, a lot of them are not expected to be profitable, to enjoy in savings, and that is something that we prepared for, realizing that it was going to take effort and work to realize those savings. But to much of our very appreciated surprise, we were profitable that first year in the ACO, and $2 million came back to Covenant Healthcare, and that was certainly appreciated. We used that money to distribute back to our physicians. We used that money to help bolster our infrastructure at Covenant, and we helped to do things like hire SNFs to help run our post-acute care facility programs. And also in hiring personnel to help support our population health programs. Finally, the dashboards and the data that's provided through Affirmant, that is appreciated. We can see our performances, and it helps in formulating how we approach areas such as post-acute care and length of stay, and has helped us to realize an improvement at our local level. And I'll turn it back over to you, Dr. Mayer.
Thank you, Dr. Gonzalez. If you'll go to the next slide. Before I do a recap here of our agenda, I just want to say that that we are very fortunate to have physician leaders like Dr. Gonzalez who really keep all of our efforts aligned with what's best for physicians and patients. And in our view, the only way that we can be successful in this new environment in healthcare is for physicians and patients to work together to make better decisions that improve both cost and efficiency of care. So to recap, we said we'd cover a little our view of the current landscape, an overview of Affirmant, and what we see as our key challenges and opportunities, the benefits for physicians of participating in Affirmant. And before we go to questions, I wonder if you could please go to the next slide. I'd like to just again go back to the decision that you have to make in how you want to respond to the changes and threats and opportunities that you have and we all have in front of us. Our goal at Affirmant is to check all of the boxes, and we are very interested in the opportunity to work with each and every one of you because we think we can be much stronger by collaborating together. We hope this has been a helpful introduction to Affirmant and to Federation ACO. And if you'll turn to the next slide, I want to thank you again for your attention. And here is our contact information. And now we would be happy to take your questions. And I'll just mention that in our conference room here at Affirmant in Kalamazoo, we have our leadership team gathered so that we can have the folks at the table who really can give you the straight scoop when it comes to whatever your detailed questions may be. So thank you again for the opportunity, and we're happy to respond to your questions.
Thank you, Dr. Mayer and Dr. Gonzalez. We greatly appreciate the information you've shared with us. For those of you on the webinar, if you have not already done so and you do have a question, if you could please enter your question into the questions box. So we'll give you a few minutes to do that. But we have received some questions already. So Sylvia, will you please read our first question?
Absolutely. The first question that we have, Dr. Mayer, is that what is the enrollment deadline for 2019 as well as for 2020?
So I'm going to speak to 2019 performance year, and then I'm going to ask Larry Green, our director of ACO operations and contracting, to speak to the enrollment deadline for 2020, specifically around pathways to success, because I know that may be top of mind for everyone. We do not have an enrollment deadline for a particular time of the year for Affirmant programs, other than for the ACO. Those timelines, as you may know, are fixed by CMS and the Medicare program. So we are open to enrollment at any time at Affirmant of new participating providers. The issue of how we would address your integration into ongoing programs and performance incentives for 2019, when it's mid-year already, is something that certainly we'd be happy to discuss in greater detail. But there is no annual enrollment process, if you will, timing for Affirmant, broadly speaking. But Larry, can you speak to the issue of CMS?
Sure. With regard to CMS, the deadline to add new participants is September 19th of this year for 1/1/20 effective date.
Thank you for that information.
Wonderful. We do have a couple of technology-related questions. The first is, do clinics need to be on Epic to participate?
Yes, this is Paul Peabody. No, you do not have to be on Epic to participate. Being on Epic is a huge advantage in terms of, and as Dr. Mayer pointed out earlier, our 6-member organizations all have the Epic electronic health record. It then feeds Constellation, which sits over the top, and it's where we aggregate all the data. But we are looking at other means to bring in information from other sources. An example would be the National HIE Sequoia and their relationship with Care Equality. Care Equality is connecting to practice EMRs such as Allscripts and Athena and eClinicalWorks, NextGen, and connection with Cerner as well, to bring in CCDA, which is the continuity of care document, standard summary of care document that we all use, and to be able to bring that into Constellation through that connection to Care Equality. So that's one way. Another way is that some of our physicians at one of our chapters use abstracting encounter within Epic to bring in information from their local EMRs, and it's somewhat of a duplication, but it's a way to get information in. And we're also looking at other means to connect to independent physicians that do not use the Epic plan.
Is there any thought of that connection, whether they are through an HIE or whether it is through possibly an interface?
Yes, we're exploring everything, and we have had some conversations with one of the leading HIEs, Michigan Great Lakes Connect. It's not a simple process. The data, even if it comes in through a continuity of care document, the mapping can be different. There's a lot of work that has to be done to make sure the data is consistent so that we can use it to calculate measures, quality measures. So the answer is yes, it's an opportunity, but it usually requires quite a bit of work to get to that, and we're exploring all avenues.
The only thing I would add to that, and this is Bill Mayer again, the thing I would add to that is that there are a lot of companies that you may hear from that claim to be able to do a mashup of electronic health record and claims data. And what we have learned is that, as some of you may already know, that a lot of those claims are when you get under the hood and you look at the specifics of how those different measures are mapped within an electronic health record system. A lot of it is custom, a lot of it is not driven by national standards, a lot of it is black box proprietary, and so we're taking an approach where we're using national standard measures. We're trying to create a payer agnostic approach to evaluating and measuring our performance, and we recognize it's a journey, but we think we're off to a good start, and we intend to continue to improve upon it over time. And we think it's a great advantage to have the largest EMR vendor in the country on our side with Epic.
Wonderful. So one more technology-related question here, and that is, how is the patient quality data collected and stored? Is it through a data warehouse, and how often is it collected? Is it monthly, real-time, annually? Can you address those?
Certainly. This is Paul Peabody again. We have a database in Constellation, and it's the same database structure as the local instances of Epic uses. It's called Caboodle, and it's where we aggregate all of the data. We bring in the data from claim sources. So for Medicare, we're bringing in the Medicare claims files every month and populating Constellation with that claims data. We're also going to be doing that with some of our other payers and working on another 2 or 3 different feeds for claims data coming from other payers. We also bring in what Epic calls their Care Everywhere transaction, which is the continuity of care document. We bring that in from all of the chapters on a real-time basis into Constellation. And also that would include any transactions from other hospitals across the country, or across the world for that matter, that are connected through Epic's network. And those would come in once they've been reconciled at the local chapter. That comes in to our Affirmant database as well. And then we populate on a quarterly basis with new patients. So we use attribution logic to match PCPs with their patients and bring new patients into Constellation quarterly.
With that data, do you have a performance report card for the physicians? And if you do, is that done quarterly as well?
We have actually a real-time updated dashboard, which is available to physicians through a web interface. And that dashboard allows them to look at their quality data at the practice level and to compare themselves with others at the practice level, but also allows them to drill down to the patient level. It allows them to see validated risk scores for patients, predictive scores on issues such as the risk of hospitalization or an ED visit over the coming year, the risk of complications of diabetes. So these validated risk scores are also available for physicians to see, as well as gaps in care with respect to our key quality metrics. So that's available at any time for physicians to be able to see and drill down in. It's interactive and immediately available. And we have through the web training system that I mentioned, we have training videos that are briefly give physicians insight into how they can use these tools. It's fairly intuitive. We also have a cost and utilization dashboard, which is driven by claims data, which speaks to the expense and utilization side of the equation. And that is available at the chapter level for chapters to look at in terms of the performance of the chapter relative to other chapters and benchmarks, their performance at the practice level, at the physician level, and at the patient level. So all of that drill down is available. And that is something that, again, is available through a web portal to the leaders within the chapter. And then we have, we're in the process now of creating individual scorecards that are static scorecards for physicians, which we intend to update on a monthly basis going forward. But all of that cost and utilization data is available through our chapters and chapter leaders currently.
And when we first implemented Constellation, it was a one direction only, so that the chapters sent information up from their instances of Epic into Constellation at our level. But now we're starting to move the other way, so it's a two-way exchange of information. We're sending back risk scores and gaps in care to be resonant in the local instances of Epic in each organization, and looking at other ways that we can share information on a real-time basis between these two areas of capability within the Epic tool set.
So one thing, if I may just elaborate for a second on the issue of chapters and how we're organized. One thing I wanted to mention is I know that some of you may be approaching the work that you've been doing together as part of the Great Lakes Network as independent practices, whereas others may be part of a physician organization or a PHO. And we are open to working with you in either of those capacities. So not only could independent practices join Affirmant, but also we would be happy to work with your current structure, if you're part of a PO or part of a PHO, in making these resources available to you as we make them available to our chapters today.
Excellent. Next question is there a behavioral health component?
Not at this time. We recognize that behavioral health is a significant issue, and we have it certainly on our roadmap as an opportunity area that we intend to address. We have started by trying to focus initially on low-hanging fruit, where other clinically integrated networks and best practices exist that we can readily adopt, and where we know we can get traction and some early wins. So the two areas or three areas there that we are focusing on are, as you heard, first, post-acute care, and second, care management for chronic disease, and pharmacy and pharmaceutical-related safety issues. So those are some of the early wins that we've been focused on. But we recognize that behavioral health is a tremendous need and a tremendous opportunity, and it is on our roadmap for the future.
Okay. Can you elaborate on that roadmap at all at this point?
Karen, would you like to speak to some of the clinical priorities that we're working on?
Sure. So our clinical transformation committee established those initial clinical priorities that Bill just alluded to in about 2016, and we've been, we're obviously in various stages of their development, but we have tackled those. And so the Clinical Transformation Committee met recently to talk about the clinical priorities for the next 3 to 5 years. And a lot of it is expanding upon the foundational work that we've done in care management, post-acute care, and chronic diseases and pharmacy. In addition to those, to specifically highlight things like palliative care and advanced care planning and post-acute care. As Bill talked about with behavioral health, that was a large discussion at that committee meeting about how that crosses over into physicians and care management, as well as chronic disease care. As we know from the COMPASS study, taking care of depression then also helps to drive positive indicators in diabetes and hypertension. So really kind of incorporating that in a bunch of different ways. And then also expanding into new opportunities around telehealth, physician-to-physician consultation, network keepage, which Bill alluded to. How do we really tackle the movement of services going from inpatient to outpatient in a way that helps to maintain health system structure and support. So those are some of the areas, as well as something like tackling HCC coding. So we have done a lot of great narrowing of focus for the next 3 to 5 years, and we're going to add in some financial modeling to some of those as well, and really kind of hone in to maybe those 5 or 6 programs that we really want to tackle in the upcoming years, and we plan to do that over the coming months.
And just to elaborate on HCC scoring, this is the risk scoring, many of you may know, that's used by Medicare, and it drives your benchmarks and targets with respect to shared savings. And in Medicare Advantage, it drives premium payments that allow you to improve shared savings. So in addition, it helps to drive our ability to be able to do some predictive modeling about patient risk. So it's an area that, as Karen mentioned, we see a tremendous opportunity for in the near term.
Thank you. The next question is, what level of support do you provide for members that are a long distance from your organizational base?
Dr. Gonzalez, I wonder if you would care to comment on that, since you're not exactly around the corner.
Yeah, sure, Bill. I would say they provide a tremendous amount of support. We hold a lot of our meetings on the web, just as we're doing here. They have support staff that comes out to the individual local CINs. They're willing to come out and sit in on our local CIN meetings. Dr. Mayer is not opposed to traveling distances to go if help's needed at a local level. The support staff at Affirmant oftentimes reaches out to our local support staff here. They're available by a phone call and easily reachable. So I would say they provide a tremendous amount of support to our local organizations.
Thank you. We do have a cost question. They want to know what the cost of joining an ACO is, and secondary to that, is it dependent on where the practice is located? Can you talk to that?
Yes. So we do not. We have a cost for our founding members, if you will, or sponsoring member health systems, because they've provided all of the initial funding for Affirmant. But we do not have a fixed cost for others to participate, such as physician organizations or PHOs that may not be affiliated with one of our member-owned health systems, or for individual practices, for that matter. And what I would say is that that we are flexible about that, and it would depend upon what the needs and resources are of the organization that we're talking with about joining. In our view, it's more important to have physicians and their practices engaged in Affirmant than it is to require individual physicians to write a check. That is not how we have operated historically. We do view healthcare as being primarily driven locally and regionally, and we think that there are advantages of organizing ourselves in that fashion. So if, for example, in the case of the Thumb, we've had a number of rural hospitals, critical access hospitals, and their affiliated physicians come to us with an interest in joining Affirmant, and we connected them with Covenant, because Covenant was closest to them, and their referrals tended to go to Covenant. And in the end, they worked out an arrangement whereby they joined the Covenant chapter and joined Affirmant through that chapter. That's one method. We also would be open to other approaches that we would be happy to discuss with individual POs and PHOs.
Perfect. Thank you, Dr. Mayer. I appreciate that. So that is all the time that we have. And we do know that we have not had the opportunity to answer everyone's questions. You will receive an answer through email following this broadcast. So just in closing, if you need additional assistance, please contact your Quality and Improvement Advisor, or you may also reach out to Sylvia Romer, or as Dr. Mayer has already stated, you could actually reach out to him directly as well. And as a reminder, we will be sending out reference documents for Affirmant Health Partners along with the PowerPoint presentation and a link to today's recording. So this concludes our presentation, and thank you for attending.
Thank you, everyone.